By Jonathan Wells and Meredith Tadewald. The action potential originates in the sinoatrial node. The SA node signals the atrial muscles to contract. It is located in the upper right atrium. It is a specialized bundle of neurons, and it is the natural pacemaker of the heart. After that, it travels across the atrium wall and then back across to the AV node, which is located near the bottom of the right atrium. The AV node is a section of nodal tissue, and it delays the cardiac impulse from the SA node to allow the atria to contract their contents first.
Action potential passes slowly through the AV node to give the atrium time to contract. Then, the action potential meets at the bundle of His. The bundle of His is a group of atypical cardiac muscle fibers connecting the atria with the ventricles of the heart. Then, it splits to the right and left. There are three branches, the right and left anterior-superior and the left posterior-inferior.
The action potential fires through the bundle branches and is carried by the Purkinje fibers to the ventricular walls. The Purkinje fibers are fiber branches that extend from the bundle of His. This process allows the ventricular muscle wall cells to contract rapidly. You can see cardiac conduction on an electrocardiogram or an EKG.
Also, an important part of the cardiac conduction system is the junctional fibers. They help the SA node communicate with the AV node. These junctional fibers are specialized cardiac muscle cells. They are long and thin, and they carry an action potential from the SA node to the AV node. There are three types of muscle tissue. In the heart, there's cardiac muscle tissue, and it has four properties that set it apart from skeletal and smooth muscle tissue. The first property is excitability. Excitability is the cardiac muscle's ability to generate the appropriate amount of action potential. The cardiac muscles send an electrical pulse that creates a single heartbeat. Secondly, they have conductivity, and that's the ability of the cardiac muscle to transfer the action potential from the muscle cells of the SA node.
Another important property is contractility, the ability of cardiac muscles to convert an electrical signal into mechanical action. And finally, there's rhythmicity, the ability to contract at regular intervals without innervations.
As you can see, there's an EKG or an electrocardiogram. A typical EKG traces the cardiac cycle or the heartbeat. It consists of a P wave, a QRS complex, a T wave, and a U wave, which is normally visible in 50 to 75% of EKGs.
The baseline voltage of an electrocardiogram is known as the isoelectric line. Typically, this line is measured as the portion of the tracing following the T wave and preceding the next P wave. The letters P, Q, R, S, and T were chosen to identify the tracing, whatever. So it's over.
There you go.
It's over. We're done. We win. I'm gonna cut that last